Hi, my name is Leanne, and I'm easily your favorite person here at DPC Health, I think. If you don't know what it is that I do here, well, I'm still trying to figure that out myself, but I do answer a lot of phone calls, especially if it's a new or potential patient asking about our membership. So today I thought I would make a video to share some of the frequently asked questions that I get on a daily basis when I pick up the phone. What is direct primary care? We are a different model of care for the family medicine world. There's the fee-for-service world where you're dealing with insurance, and then there's our model of care where it's more membership-based. It's like an alternative to health insurance. Instead of dealing with your co-pays, premiums, or deductibles, you're paying a low monthly membership fee, and you get all of the services that we have to provide. I really like this care model just because, like, in a fee-for-service world, it's not the doctor's fault, but they're on, like, insurance time. So essentially, it takes you 2 weeks to really get an appointment with a doctor. You sit in the waiting room, and then you only get 10 to 15 minutes to talk with the doctor. Here, we're on our own time, so we really try our best to limit you in the waiting room. When you see Dr. Nguyen, you can spend as much time as you want with her, ask her any questions you may have, really get the knowledge and education that you're here for. And if you're really sick, like, we'll do our best to accommodate you same day, last minute, without making you wait a whole week or another day just to come get treated. Do you cover women's health services? So the answer to this is yes. We do our best to cover as many of the services as we can, but the basics that are covered with your membership are pap smears and breast exams. And when you come in and you see Dr. Nguyen, she's going to evaluate like where your levels are. If you need to be treated for hormones in addition, then we also do that as well. Do you take care of pediatrics? So the answer to this also is yes, we do. Dr. Nguyen is great with kids. She loves them. So we take care of children as small as infants to adults. And the only thing I would say that we aren't able to provide for our children here is immunizations. That is something that we do refer to the health department, and we can help coordinate that. But unfortunately, immunizations just aren't something that we're able to provide at this time. Other than that, just checking on the growth and the wellness of a child, we do that all here at DPC Health. What happens in the case of an emergency? This is a very common question I get asked all the time, and I completely understand this is a one clinic, one doctor place, and there may be some needs that you may have that requires you to go to the ER. However, Dr. Nguyen does everything she can to make sure that she prevents that from happening. If you feel like there's an emergency that's going on, you can call or text us 24/7, and Dr. Nguyen will be able to screen and check in with you with your symptoms and let you know how she can handle it and help you. She'll meet up with you at the clinic after hours if absolutely necessary as well. However, we understand that things like cancer, heart attack, or stroke do require emergency room visits. And so for things like that, if you need catastrophic coverage, we do recommend some third-party companies and people to work with in order to get you that coverage that you need. So one of the options would be health sharing. These are very common for direct primary cares. We work closely with Sedera and Zion Health. They work the same way where you pay like a monthly membership fee, and then depending on what your needs are when you have an emergency, they'll do their best to cover the majority of that for you. We also recommend working with our insurance broker who can pair your DPC membership with a high deductible insurance plan. That way you're not paying too much out of pocket for double the coverage of things that you need. Our broker also has something called an association benefits that I personally use for myself. And essentially what that covers is emergency room visits. For like $89.99 a month, I'm covered in the off chance that I do get sent to the ER. There's coverage there where I don't have to pay out of pocket. So there are people that we can set you up with to talk to and help you coordinate the extra care that you need if DPC Health can't cover it. What if I or my child breaks a bone? Can you do x-rays? This is actually a very common thing that happens here a lot for our patients. If you come to us with something that feels like a broken or fractured bone, what we'll do is we'll actually send you to our imaging partner where they will have very low cost options for our patients and to get your imaging done. When Dr. Nguyen receives the imaging back, she can then determine if she can cast or splint that area, and that's all covered here at DPC Health. So we won't refer you out for anything like that. And if it's like an immediate pain or concern, she is going to meet up with you after hours on the weekends. We've all have been here with Dr. Nguyen after hours to help somebody get casted or splinted here. So that is something that we can take care of for you. What if I need a referral? If there's a medical concern that needs to be addressed that Dr. Nguyen may be not as knowledgeable about, she's going to go above and beyond and try to educate herself, understand it, and figure that out for you without referring you out to a specialist. However, if she absolutely has to refer you out, she's going to refer you to somebody that she trusts. She's going to do her research and make sure that this is a specialist that she knows and can count on. She's also going to coordinate care for you. So once you become a DPC Health member, we're here to take care of you no matter what. And we're not going to say, hey, this is something you need done, go figure it out, go Google a doctor or specialist, get in and take care of it. We're going to go the step further and make sure that the specialist is doing what they need to do to take care of you. She's going to call and coordinate care where she's going to just follow up and see what it is that she can do to help make sure that you're in a better place with your medical concern. So you can really trust that our team is going to be here for you. What makes DPC Health different than other direct primary cares? As you already learned, DPC is a common model of care that other physicians may implement on. You may see other DPC doctors in this area in other parts of the United States. However, we are not a franchise. DPC Health is a one doctor, one clinic location here in North Fort Worth, Keller Alliance area, and we absolutely pride ourselves in all that we do. Dr. Nguyen is not only board certified in family medicine, but she's also board certified in obesity medicine, functional medicine, and aesthetic procedures. Not all DPC doctors have the qualifications to do all the additional stuff, and Dr. Nguyen has gone above and beyond in order to get certified so that she can be able to take care of you and be your one-stop for all your medical needs. When you come meet Dr. Nguyen for the first time, she does very comprehensive physicals for you. All of the doctors out there can do physicals, but with Dr. Nguyen, she's going to check things like the skin examinations and mole examinations to make sure nothing is cancerous or concerning. If need to, she can excise and send it off for biopsy to check. That woman loves a surgical knife, so she can do more than other doctors can. She also has a body composition machine that she's going to put you on that measures your fat mass, muscle mass, water retention. This is important to her because she wants to make sure that your muscles are strong, and there are things that we can do to implement to keep them strong. In the long run, she doesn't want you to be on a cane, walker, or wheelchair. She's going to make sure that she's going to implement practices to help you stay healthy and walking as you get older. Is there a contract to be a member with DPC Health? Our members are on a month-to-month basis with us. Your membership gets auto charged every month. If you want to pay up front, you absolutely can. We do ask that new patients commit to at least 3 months before canceling, because Dr. Nguyen does go above and beyond for her comprehensive physicals, that she's going to make sure that all the things that she addresses in that first initial visit is going to be taken care of before she lets you go. And so that's very important to us. But yeah, no contract. You can sign up and just cancel anytime. We do ask that you let us know in writing about 30 days in advance. Okay, last question. It's the best question. How do I become a member of DPC Health? This is a super simple and easy process. You can go on our website at dpchealth.com and fill out our online registration form. All the information is there. It's just going to ask you for your basic information and then your payment method. If you do need some help or guidance, you can call me anytime. We'll be able to help you and walk you through that process ourselves. Our phone number is 682-200-0035. And for a limited time, we are waiving our $50 registration fee. So if you're watching this video or if you decide that you want to sign up, just let us know. We'll be able to waive that $50 and save you a little bit there. That's all I have for you today. If there's any questions that I may have missed and you want to ask any other questions, feel free to call or text us anytime. Our phone number is 682-200-0035. Thank you for choosing DPC Health, for medical care is redefined.